And we're recording. Okay. So, third time's a charm. We're going to make it work this time.
Let's do it.
We're going to talk about the, so we've already done this twice. So, coronavirus, blah, blah, blah. Mitigation, blah, blah, blah.
We're going to zip through it?
Zip right through it now. Well, every time we do this, things change by the time we've started talking about them. Just to open up, I have to do the disclaimer. This is Craig Faulkner. He says he's a doctor. We've known each other for 30 years. I'll skip the whole part about where you're not supposed to do anything to me if anything ever happens to me, because I don't believe you're a doctor, because everybody's heard that joke 9 times. But
nobody's actually heard this yet.
That's true.
Only your wife has heard that.
For the purposes of this, where did you go to medical school, and when did you graduate?
I went to Chicago College of Osteopathic Medicine and graduated in 1995.
You're sure?
I'm pretty sure. It's rough. It's getting longer ago. It's a little over 5 years ago. So
a little over 5 years ago. And then when you graduated, you moved back to Pennsylvania and practiced. You started in Erie and then moved back home.
Correct.
And you're in the Johnstown area.
Johnstown area, yeah.
And you have your own practice, plus you do other things.
Yeah, I'm a family doctor. I work, I moonlight in the ER on occasion, and in the medical director of 4 different nursing homes.
Right. And so you have, as far as this virus goes and what we're talking about, you have a reach into the hospitals, private and nursing homes. So you have a pretty good overview of your area and what you're seeing. So again, we've done all this, and we're going to keep referring back to 2 times that we tried to do this and it didn't record. But you are seeing a limited amount of positive tests in your area and the rural areas of this part of Pennsylvania.
I've seen two positives in our hospital setting from inpatients that we've had, and I have 1 positive from a patient from my office, an outpatient, and he did not need to be hospitalized at all.
Hospitalized, right? And that's been the 2 patients you got was fairly early in the shutdown of Pennsylvania, wasn't it, or the spread?
Correct. Actually, we actually had the first patient in our county at our hospital. The first one was the first case that was documented. So yes. Okay.
So one of the things that we talked about is the difference between. Well, here, let me back up and put it this way. The hot topic is, when are we going to reopen? Because we've been on quarantine for 6 to 8 weeks, depending on when you want to look at it. And why are we treated the same as the eastern part of the state that has so many more cases and deaths and everything else? And we're very fortunate on this end of the state. You live in a rural area. I live in a rural area. And so we don't have mass transit. We don't have a bunch of people taking the subway to go to work. We take our own cars. We're very socially distant in our lives, where our homes are. I can get there's no one within 20 feet, let alone 6 feet of where we live. So that has helped us on this end of it. And your fear was that at some point it was going to reach us and grow. And it just hasn't done that yet.
Yeah, I mean, we anticipated it to happen. I mean, I know Dr. Burks, when she first, early on, I remember her saying, this is how it starts. It starts with 2 cases, then it's 20 cases, then it's 200 cases, then it's 2,000 cases. So fortunately, our county, we've been in the 20s, I think, for over a week now. And we really, this is technically 6 weeks or so into it. And we haven't gone above 30 yet. It's still slowly climbing, but then you got to remember that, of those 25, probably half of those people are resolved by this point. Yeah. So in terms of active cases, our county probably only has 12 or so active cases. So yeah, we were anticipating it, and I think what we're doing is working. The social distancing is working, and again, we have it easier than like New York, like you said. These people, these essential workers, are still having to go to work, and the only way they can really get to work is they go on the subway. So it's kind of hard to social distance. Who's wiping down the subway, right, to prevent the spread? Where we can go in our own vehicles to work, and if we practice social distancing when we go out to Walmart to get our essentials, wear our mask, and wash our hands, I think we can continue to keep the spread, slow the spread of the virus.
Right. And with the nursing homes, you're testing everyone that goes into the nursing home. You're seeing.
It depends on the nursing home, yeah.
So you're seeing you're seeing more negative results than anything.
Correct. Yeah. Some of the nursing homes are requiring COVID-19 testing prior to them admitting a patient, which I think is probably a good idea, or a significant screening for those patients, because that's where the high mortality is in that setting of patients. And if it gets into a nursing home like we've seen in Washington State, it just kind of spreads like wildfire, and that's where you have a high mortality rate. So they're doing a lot to prevent it from going into the nursing homes. The nursing homes, just like the hospitals now, have no visitors allowed. I mean, it's unfortunate because obviously that makes it difficult for people to see their loved ones. They're at the end stages of their life, and it's not optimal because of that, but that's what we have to do right now. They're kind of shut down, and they're screening everybody. In fact, I am not going to any of my nursing homes to see my patients. I'm doing all telemedicine because I do see acute patients. I've had a couple positives, and we're still screening people on a regular basis, so I never know whether I could be a carrier or not, so I'm not going into the nursing homes because of that. And it's that's again the high mortality rate in that population, so we're trying to keep them protected.
So you and I agree, we can understand why people are getting frustrated real easily by saying, why are we in lockdown? Why can't we go to work? Why can't we open our business when there's when there's a limited number of cases? And one of the things that we've emphasized is there's a really high survival rate for this, but there's also a really good chance that you will catch it if you're around someone that has it. It's very virulent.
Virulent.
It's on the third try. I can't even remember the words, but it's very easy to catch. And because no one has an immunity to it, you don't know what how you're specifically going to react to it. If you have certain preconditions, some of the things they've said of diabetes, it's type 1 diabetes, if I remember correctly.
It can be either type of diabetes.
Either, okay. Lung problems, whatever that may be.
Lung problems, definitely.
Elderly.
Heart conditions.
Heart conditions.
And elderly.
And part of that is... Go ahead.
And I think obesity has been one of them.
Oh, crap. I'm done. I wasn't on the list till there. Damn it. One of the things we talked about is that because you don't have an immunity to it, sometimes your immune system overreacts to this strange invader into the body. And this goes back to what we were talking about, the 1918 Spanish flu, where a lot of the symptoms and a lot of the things that killed the people wasn't so much that the flu was killing them, it was that their body reacted in such a way that they weren't getting oxygen. The lungs were a lot of lung problem, obviously, and this is acting sort of the same way despite being a novel virus, which is a new virus.
And one of the things you hear talking about is ventilators, right? They're talking about ventilators. One of the reasons why they wanted to flatten the curve was to make sure we had enough ventilators and hospital beds. But the other thing they've noticed that unfortunately, if you get to the point where you need to be on a ventilator, you have about an 80% mortality rate. And actually, some of the studies that they're looking at now is that it's actually maybe detrimental to put somebody on a ventilator. There's a condition called acute respiratory distress syndrome, and it's actually an inflammatory process in the lungs. So it's not that they can't, and that's why they can't get oxygen. So it's not a lung problem, it's an inflammatory problem. And so a ventilator pushing air into the lungs can actually cause more damage in that respect than, it's like forcing a balloon to expand beyond its, it causes barotrauma. And so they're looking at, maybe putting people on a ventilator is not a good option for these people. So, so what you're talking about is that it seems to be an inflammatory response in the lungs that's causing a lot of issues with people.
And we'll get back to some of the treatments and whatnot, but one of the things we keep going back to on the third time that we've done this is that we're living through it. We're not looking back at it. So you're going to see, and this will tie into the other thing we talk about, which is misinformation, social media, choosing sides, who do you believe? Things can change as soon as they get new information. That's how it works. It's you see where they want to try this particular drug because it's an anti-inflammatory. Well, that might be the way to go. Or there was a story a couple of days ago about nicotine patches, because it seemed like the nicotine reacted with the cells the same way that the virus did and was blocking the viruses. And I think it was in France they were trying to use nicotine patches. And then there was one about Pepsid a couple days ago, and then today I read, no, don't take a whole bunch of Pepsid trying to cure yourself of the disease. So there's a lot of people looking for a miracle drug, quote unquote, and willing to try these things, but we really won't know until we get to the other end of it, and then it might be time.
Yeah, I mean, and that's one of the other reasons why they wanted to flatten the curve, other than, we talked about, to decrease hospitalization, or to make sure that there wasn't overwhelming the health system.
Right.
Make sure there was enough hospital beds, make sure there was enough ventilators. But the other reason why is if you slow that curve, if you slow the spread of the disease by flattening that curve, then you can test different types of treatments that may help and figure out what works best for people, and gives you a little bit more time to come up with plans of treatment. There's, like we talked before, it doesn't look like there's going to be a cure per se, and if there is like a vaccine, I mean, that's down the road. So they're not flattening the curve to wait for that vaccine. They're flattening the curve to decrease the strain on the medical system, make sure that the hospital beds are available, make sure enough ventilators are available. And I think they've shown that they've done that already. It looks like that's actually happened. And then, working out what medications that we already have available will help us, and what treatment strategies are available. Is ventilator the right thing to do for these people? Is it not? Is it just high flow O2, BiPAP, that kind of thing doesn't cause so much trauma to the lungs. So yeah, it's gonna change on a daily basis, because like you said, we're living through it, and we've never seen this before. And they have to study how your body responds to it, and and what treatment modalities that we have work for it.
Right. And because of that, again, it feeds into the people that want to say you could look at any statistic and choose a side here. You can say, well, 98% of people are recovering from it. That we think. We don't know how many people actually had it because we're not doing testing on everyone. So it's easy to say, well, we're overreacting, it's overblown. Or you can look at the other end of it and say 2 to 3% of the population that get it dying is way too much. If you want to believe the government's numbers that it could have been 2 million people had they done nothing, had they just
2 to 3 million, yeah,
right, 2 to 3 million, just to let it. If they just would have let it run through the country, and oh well. And we're past 60,000, 61,000 now, I think, is what the number is today. And I think when we did it on Sunday, when we tried this the first time, it was 45,000.
right.
Yeah. So the numbers they're still rising, and that leads into the whole when do we open up and do things? And you see Florida, Georgia, Texas, some that are starting to already open up, and they haven't hit any of the federal guidelines that were handed out, which I think is 14 straight days
Right.
of decreasing cases. So you almost have to, you said this last night, you almost have to have someone take that first step. You have to have someone jump in and say,
Right. Somebody
okay,
has to do it.
what's going to happen? I read a story at lunchtime today that some rural areas are becoming new hotspots, and most of those were in Florida, a couple in Texas, and then Indiana, Ohio, Michigan. And there was nothing in our area per se, except one of the ones in Ohio was like on the border, it would have been the northwestern border of Pennsylvania, northeastern border of Ohio. Some of these rural areas. Now, I don't know why that is. Now, in Michigan, it could be because they're, gathering in protests. In the southern states, they closed late and they're reopening early. So it's going to be interesting to see. And again, we're repeating ourselves a lot because we've talked about this. It's going to be interesting to see what happens if those numbers spike.
Well, yeah, I mean, that's the problem with potentially opening up too early. If their numbers spike too much, does that affect the rest of us who are still in lockdown?
Right.
And then the governors kind of put the brakes on and say, we're not going to do this. Now, interestingly, Switzerland did not have a lockdown at all.
Right.
And again, we won't know till we're through this which way worked better, or were they equal in terms of mortality.
Right.
Because when they talk about flattening the curve, they're talking about flattening the curve of infected people. And when they do that, this is the potential curve initially. Well, they want to flatten it so it's more like this. But the volume under the curve is technically the same.
Right.
In other words, the people that are going to be infected are the people that are going to be infected. The number of people that number really isn't going to change until you get a vaccine. Or if summer affects this virus a little bit, that would slow it down. But then again, we're talking back in the fall, it's back because you can get the flu in the summer too. It's just not as prevalent. We don't know that this is going to go away over the summer. And if it does, they're pretty sure that it's going to come back. So we're flattening the curve again to not overwhelm the health system and to kind of come up with good treatments for this so less people die. But for the most part, the same number of people are going to get it unless we get a vaccine rather quickly.
Right.
Which I know they're working really hard on. It sounds like they might accelerate something in 6 months, but typically it's going to take 18 months to come up with it.
Fauci was on one of the morning shows, and I heard a clip later in the day, and he said something about potentially maybe by January. And the person interviewing him said, that would be amazing if we had it by January. And he said, I told you last January, 12 to 18 months. That would be 12 months. I mean, he's just so matter of fact about stuff. He's like, I told you.
But I've seen, I forget what they're calling it. it's sort of like the modern day Manhattan Project. They have
Operation Time Warp or Warp Speed. Warp Speed.
Warp Speed. Okay,
Warp
yeah.
Speed, yeah. Not ludicrous speed.
So they're
Warp Speed.
right. Yeah. So they're really working on that, which would be great.
Yeah.
But there's a lot of hurdles because the coronavirus, it's a family of viruses, and we haven't really ever had a vaccine for the coronavirus. The common cold is a coronavirus, and we don't have a vaccine for that. Now, it doesn't kill people. I mean, it's a nuisance, but it's been around forever, and we've never come up with a vaccine for it. So there are some hurdles here. There has been a vaccine, so if anybody out there seen the little thing that's going around, there's a canine vaccine.
That's on my list to talk about.
And my daughter's a veterinarian, so I'm pretty sure that actually was pulled, but it doesn't work in humans. So, and plus it's a different type of coronavirus. When you see coronavirus, that's the other thing that people saw on Lysol, that it says it kills coronavirus way before the president said anything about it.
Right. And let's stop there. Let's do this. He didn't say inject it. He
did not say
saw a sign
or ingest it.
Right. He saw a sign that said light and disinfectants kill it on surfaces, and he started doing a stream of consciousness thing, and no one said shh. We'll talk about that later.
He didn't. He asked a question, and again, there's no such thing as a stupid question, but there is probably an inappropriate time to ask that question, and that was probably an inappropriate time in front of cameras and everything. He should have asked his team either before or after, but a light bulb went off and he just went with it. But
that's what he does. And because he's polarizing, people think he told them to drink bleach. And on the other side, you have 100 people who actually did try to do something, or called. In Maryland, I think they said they got 100 calls on people saying, "Can you really use disinfectant?" So, I
think they called poison control, and there was a lot of people calling poison control. But now, whether they were calling that as a joke, I don't know, because they had no 30 people call that one day. And no one either actually did it or suffered from it.
Right, yeah.
So anyways, on Lysol, it does say that it kills the coronavirus, and people are saying, how has this been around? Well, the family of viruses, the family of coronaviruses has been around, yes. So it's not a conspiracy theory that Lysol has ability to kill this because it just came out, but this is the COVID-19 coronavirus, so that's important to know. So anyway, so if you see the vaccine story, there was a canine coronavirus. It's not this coronavirus, and I don't think it's on the market. I'm not a veterinarian, but I'm pretty sure when I talked to my daughter about it, she said that it was pulled, so they don't even have it anymore. I just saw a post today with someone sharing that, by the way. Just today. We talked about it. What was that?
I just saw a post today that someone on Facebook, someone was showing that,
Right. So that's the other issue that, we discussed was, social media in terms of the coronavirus. And again, it polarizing people, like, the conspiracy theorists saying, this is basically to shut down the government, bring socialist medicine. There's, like we talked about the other day, was how do they convince all these countries to do that? Number one, how do they convince Italy to have all these? Hey, why don't you guys have all these deaths? Well, and overwhelm your health system so that we can do socialism here in the United States. And I think the bigger question is how do they get Trump to go along with it?
Yeah, exactly. Trump, I said George Soros. That's how they did it. How do you convince Trump to stand on stage and go from at one point where he said, "Oh, it's no big deal," to now how did they change his mind, knowing full well that if that was the secret plan all along, was to bring socialism and Medicare for all to the United States? Why would he go for that?
Right. And again, unfortunately, there's a couple issues here. We're doing a good job of flattening the curve. So, and the mortality rate doesn't look as bad as it initially thought it to be. At least, hopefully, they did those studies in New York where they checked people with antibodies, and they found about 18% of the state of New York probably has been exposed, 21% in the city, New York City. And if that's the case, that drops the mortality rate down significantly, which would be great. But we won't know until this is pretty much tallied at the end. You know what I mean? They can have their projections of what the mortality rate is and how many people are going to be infected. But we don't know until, as we're living through it, you don't know.
No. And there's people comparing it to the regular flu, the seasonal flu, and to H1N1 and SARS and the death and everything. And, the flu kills so many people per year, and we've lost 60,000 people in 3 months. And a difference.
Right. Now, yeah, correct. That is a difference. It looks, H1N1, I believe, was projected to kill 600,000, something like that. And I think it killed almost 70,000. Again, the demographics in those mortalities were different, though. The elderly were actually almost protected because they had some type of immunity from a strain of the flu,
because
where the younger
was in.
Correct. Right. Yeah. Correct. And then the younger, it was actually killing younger people. So I think it almost killed 70,000. I think it was projected. Yeah, its whole entirety. And we did come out with a vaccine for that.
Yeah.
It's in with the flu vaccine now.
That I don't get.
That you don't get. And then, so the question now, like we discussed, is how do you open up? When do you open up?
Right.
And what's the best way to do it? Somebody has to do it first, and they're doing that. But I think
knowing that it's not going away, it's going to be out there.
I mean, if it's not going away, it's going to be out there. We can't keep sheltered for 18 months. So, and I think number one, as Americans, we've done a good job. I think for the most part, the majority of the Americans have said, okay, we're buying this, we're going to do this, we'll do it. Not without, hassles, because it has caused issues. Obviously, our economy is tanked, and businesses are going down, and businesses are technically people. There's people involved in those businesses. People are laid off. Family-owned businesses that have been generational, they may lose them. So there is some hurt there. There's people that have, issues with staying home or not being able to do things. There's, I think everybody's probably getting some cabin fever at this point. But there's, if you have high anxiety, depression, this is probably taking a toll on you.
Right.
I'm sure, I haven't seen statistics, but I'm sure suicide rates are going to go up. I'm pretty sure I've heard that domestic abuse has gone up.
Right.
And we talked about that the other day about, how it affects, reporting domestic violence. If the child's being abused, the number one advocate for that child is usually his teacher or somebody at school.
Right.
And if they're not there, then they're not getting the support that they need, and that goes to show in general how our society works for each other, and we're not really able to do that when we're sheltered at home and we're social distancing.
There's a cascade effect of this in that you start to see how things break down so easily.
Right.
Students, besides just abuse, sometimes that's the only place they get a good meal is at school. And people
Right.
had to step up. And my wife works for a food bank, and so they've seen the uptick in the number of people, that are in need right now. So the safety nets in this country that for the last 40 years we've moved away from taking care of the workers and things like that, and moved more into a work harder, make more money, the way it's just been the politics of the country since 1980 something. We're seeing how that whenever
Right.
we had a true emergency, the safety net isn't there. I'll give you a good example. Something I read today about the true unemployment number and how they figure it out based on number of claims and whatnot. Florida's unemployment rate only went up like 2% through April because their system can't handle the number of people filing for unemployment. So none of those people were counted yet. So the 350,000 people or whatever it was that are unemployed aren't in the system yet. So it looks like Florida doesn't have an unemployment problem, but it's just because the system to help the unemployed isn't working. It can't handle this. And I agree with you that most people have handled it fairly well. I mean, obviously people are upset and people are hurting. We know people that have their own businesses and are out of work. You and I are fortunate that we're both working. My wife is working. My daughter's working. So we're able to, our lives haven't really changed other than the wearing of the masks and the lack of socializing with our friends and seeing our family. We haven't seen my parents in a month. You haven't seen your mom. And we'll talk about when you let her out of the house. But and I know she's high risk, and that's why. But it's
you're gonna make my mom watch this whole thing so she knows how she gets.
What'd you say?
You're gonna make my mom watch the whole way to the end until we tell her when she can get out.
When she can get out of the house, yes. It's the spoiler at the end.
Yeah, she has to watch the whole way to the end.
But there's a whole bunch of issues now, and we keep saying as we already said, because we've done this twice now, which is why Michelle won't sit out here tonight and listen to her the third time. What we said, we hope that everybody learns something from this. I had a discussion with someone online about he was upset that people keep saying this is the new normal. This is the new normal. And I disagreed in that it's not going to be where we're locked in our houses and you can't go out to restaurants and you can't congregate, but wearing masks, especially in the flu season, having hand sanitizer everywhere, those kind of things are going to be more prevalent because they have to be.
Right. So that's where I was going with, how people have come together in the first phase of this. So the next phase is basically how everybody else can change a little bit of the way they do things, so that we can open up and it will still mitigate things a little bit better. So just like 9/11, with travel, you used to be able to go to the airport like a half an hour before the flight, go through security real quick, and you could have a pocket knife in your pocket. You could have you could walk on with your soda, but 9/11 came, and then all of a sudden it was different. And the first couple times you travel after that, it's like, oh my goodness, look at what we have to do now. Now we have to take our shoes off, we have to take our laptop out, we have to, we can't have liquids on the plane. But guess what? That's our new normal now, and we got used to it. So I think what we need to transition to here is our new normal. Is everything going to stay? No, I don't think so. Maybe like you said, the mask only during the season? Is this going to be a cyclical thing? Is this going to strain going to mutate that we have to have, an issue with getting vaccinated with it every so often, whether it's once a year or every 3 years? So are we going to use masks? But one of the things we can do right away when they say, hey, you can go out to a restaurant, is, the restaurants are going to have to change the way they do things. There's going to have to be hand sanitizer right away when you come in to the restaurant, probably at every table. There's going to be distancing issues initially. You're not going to sit right next to the other people. Every booth isn't going to be used. At Walmart, there's already hand sanitizer there. We're all going to Walmart still because that's they're they're about the only people that aren't hurting is the owners of Walmart, because their stocks are going through the roof, because that's where everybody wants to go, because that's basically all there is. But I mean, they have hand sanitizer, but they should have hand sanitizer at the checkout too. And I haven't seen that yet, but that's one of the things that they need to do, because you've touched things there, and you need to be able to sanitize your hands before you go and after you go. And these are the things that we're going to have to start doing. This is going to be our life. Wearing masks initially, for sure, we're going to have to. You want to go out and enjoy life, that you're going to have to do that, because it does protect the spread of the virus.
Right.
Again,
go over
wearing a mask
too. The mask is if you're sick, but it also protects you. It will help if you're not sick.
Correct. It helps a little bit if you're not sick. So, the virus is in the mucous membrane. So if you're infected and you cough or sneeze, it sprays into the air, and it can go. I'm sure everybody's seen the videos. It can go, pretty far depending on what's going on. But that's where they come up with the 6-foot rule. So if you're 6 feet, you're protected to a degree. But if you have a mask on and you're away 6 foot, you're protected even more, but still not significantly, because that stuff is getting to you. But if I'm wearing a mask and I'm coughing, that is not really going more than inches beyond my mask. It's going to escape the mask a little bit, but it's going to hit that mask, and the force of it spreading is significantly minimized. I actually had a patient tell me today, she saw it on Facebook. She said, if you think about, if you're both naked and one person's peeing and you're right beside each other, you could get peed on. But if you have clothes on, you'll still get wet, but not fully wet. But if they have clothes on and they pee, you're not going to get wet at all, because it's going to stop it.
That works.
And I said, that works. If that visualization does work, that's true. And and you're 6 foot away from that person. What was that?
Unless you want the other person to pee on you.
Yeah, unless you're into that.
And why are you naked out there
anyway? I don't know, but I thought it was a good analogy. It makes sense. If they're wearing clothes and they're peeing, very little is going to get on, very little chance you're going to get wet. And especially if you're 6 feet away from them, It's not going to happen at all.
Exactly.
Right. So I said, yeah, I kind of like that, so that's exactly why wearing a mask helps. It helps mainly if you're infected, and you don't know if you're infected, because you could have no symptoms, or you could have just got infected and your symptoms didn't start yet.
Right.
So that's why they're recommending wearing the mask. All wear the mask, then we all benefit from everybody wearing a mask.
We were talking about.
Can you hear me?
Yes, we were talking about masks and how they help, and then washing your hands, how important that is, and something you and I had talked about before, obviously, when we did this multiple times, and I'm going to keep going back to that because it's so frustrating that it didn't work before, is that it would be really nice if we saw more of our leadership leading by example,
Right.
wearing their masks.
Yeah.
We've talked about Dr. Levine from Pennsylvania is one of the people. She always comes out with her mask on every time. It's like you're in kindergarten, how to wash your hands, how long to wash your hands. But some of our higher up leaders don't necessarily wear masks in public. And one of the things we talked about was it would be nice if when they had the briefings, the national briefings, if they had sanitizer on the podium, because everybody's touching the podium, everybody's touching the microphone.
Right. And I think whether they're getting tested or not, I know Vice President Pence was touring a hospital and he wasn't wearing a mask, and I guess his reasoning is he's been tested and he knows he's not a carrier, which is great.
Today they said they didn't.
You got to lead by example.
Yeah, today they said he didn't know. He didn't know.
He didn't know he didn't have a mask on.
He didn't know. Well, first he said he wanted to look him in the eyes while he's talking to them, which that was a dumb answer because the mask wasn't over his eyes.
I mean,
he's not Batman.
I understand. Again, none of us like to wear the mask, and
right.
like when I'm
just say that then. I don't like wearing the mask.
No, I mean, not only that, I mean, wearing it is uncomfortable, but it does take away part of the human element. You know, if I'm doing this, it takes part of the human element out of it, obviously. And I understand to a degree why they want to show their face, because they're politicians and they want to show their face because that's how it works. But
just say that.
It's, you know, it's like an actor, you know, they don't want to be in a movie where their face is covered all the time because they get no publicity out of it. So, but in this instance, they need to lead by example, and they should wear their mask, and they should hand sanitizing is actually even more important than wearing the masks. I want to stress that because, wearing a mask does protect people from the sick, from it spreading if they're coughing and sneezing. But what I suggested yesterday when we talked is one of the other things is when people are sick during this quarantine or this pandemic and we want to open up, then those people are going to have to understand that if you're sick, if you know you're sick, you need to stay home. Because that's going to help too. You know, you're not going to say, oh, you know, my friends are going out and I only get to go out. You know, I got a fever and I've got to go out, because that just puts everybody at risk. So that's some of the behaviors we're going to have to change. And like we talked about with employers, you know, how are employers going to get their employees back? Well, one of the things they're going to have to do is loosen up this,
sick leave.
You know, their sick leaves, you know, because, you know, you're going to not want somebody to come in. You know, I know, for example, back when H1N1 came out, our school had just adopted a stricter absentee policy, you know, where you only got 3 days unexcused absence, and then you had to get a doctor's excuse, blah, blah, blah. It was pretty strict. Yeah. Well, then H1N1 came, and they had a conference, and they said, if your kid's sick, keep them at home. But it's like, well, okay, you just told us, you know, we only get 3 days. If our kid gets this or gets the flu, they're going to be sick for 5 days, you know. Right. So, you know, so there's going to have to be a lot of wiggle room with that. But, you know, in terms of what the individual can do is wear the mask, wash their hands, and not go out if they're sick.
Right. And a lot of that comes down to education, knowing what the symptoms are, which they change, knowing that the information is out there. Most people have a smartphone or internet connection, most people, or at least it's on television and the newspaper. And as we said, you can find information to support anything you want. But in general, having a fever of over 100, they say if you have that fever, you have to go at least 72 hours without medication and no fever before you're considered safe to go back to work or to go back to wherever. I mean, something simple as that. People just need to know. They need to get educated. It can't just be I'm tired of this and I want to go outside. It has to be that that's fine. We all do, but we need to know that there are limits, there are rules, there are things to do to make it safe for everyone else, which leads us into the talk about herd immunity and it passing through everyone. When you have all those negative cases up where you are, sooner or later it will pass through, and how many people will develop that immunity, we don't know yet because we don't know enough about this virus.
Right, and so herd immunity is when enough people either have antibodies, let's just say it that way. So whether they got the disease and have developed antibodies from it, or they had a vaccine and they have developed antibodies that way. So it's dependent on the disease. Again, how many people need what percentage. Sometimes it's as low as 40%. Usually it's up to 80 or 90% of the population has to get that to have herd immunity. And so if you think about so for this virus, most likely it's higher because of it being so virulent and easily spread. So it's going to be higher. But what you think of is those people who have antibodies are basically shields because it spreads from person to person. It's a virus. It needs a host.
Right.
It can't live on its own. It needs a host cells to replicate. So it can't replicate on its own like a bacteria can. A bacteria can reproduce cells on its own. A virus is an RNA or a DNA sequence that actually invades a cell and then uses that cell to replicate itself. So it needs a host. So if you think of it as these people with antibodies, they're a shield from other people. So if there's enough shields around, not letting it get to a host that it can get to, that's where it helps. So if, let's say, 80% of the population gets antibodies, then the rest of the population, it's pretty much buffered enough that they're not going to get it.
Right.
So that's where, when we open up, it's going to be high-risk patients or high-risk people should not go out when they first open up. Those are the people that are really going to want to continue to stay at home. And that's the other thing, just because they open up doesn't mean that, everybody has to go out. If you don't feel comfortable doing that, then do not do that. And if you have...
That goes back to your talking about employees too and employers. If your business has been closed and you want to go back and you need the money, if you're in one of those high-risk groups, is it worth the potential health risks? And how are we going to handle those people unemployment-wise who are saying, we're offering them their job back, but they won't take it, so they shouldn't get unemployment? We have to look at those things.
And I told you yesterday, I saw, the theme parks in Florida, because they're starting to look at that and how they open up. Right. And their phase one excludes employees over 65. Those people should not come back to work.
Right.
So I think it may have been over 60. So those people should not be coming back to work because they're higher risk. So, that's something we are going to have to phase into this too, is those people are going to have to, stay quarantined a little longer, unfortunately. And then hopefully, the people that are healthier get it enough, and there's antibodies enough, and it's safe enough, then, who knows how long. But again, while we're doing this, we can still be safe. I'm not saying have, like they used to have chickenpox parties. So,
right.
if your cousin had chickenpox and your mom would take you over to your cousin's house, so you just get them and get it over with. We used to have what they call chickenpox parties. I'm not talking about that. I think we can still be safe, try to avoid getting it, but I think over time it looks like the majority of people are gonna probably have to get it. And then the question,
and we will.
Right. And then, so the question is when can the at-risk people go out? And I think they can go out if they follow. I mean, we're going to have to watch the numbers when they start opening the states up, and that's, and we talked about that before. Like, if our low numbers in our county gets to open up, but Allegheny County's not too far away, they say they want to go to the steakhouse, and they drive, an hour and 10 minutes to a county that's open up. Are they just bringing it over? That's where it's not black and white, it's gray. And pretty much nothing's black and white. Nothing really in the world is black and white. There's gray. And that's what we got to find, the right shade of gray, I think, is what we have to do.
It's almost the point where you have to. One of the things that we had said was Americans in particular culturally are very don't tell me what to do. For at least in the long run, they might listen for a short term when they see huge numbers of people dying, but then eventually that wears off, and that great American can-do spirit kicks in, and they want to go out and march and do whatever they're going to do. But it's almost to the point where they're almost right. We're going to have to. Here you go. It's open, or at least it's open on a limited basis and expands. And now it's up to you, the individual, to decide how much of a risk do you want to put yourself at based on your own situation. Personally, I don't feel like I'm that much at risk. I still don't think I would go to a baseball game or a football game and want to sit right up against somebody, yelling and screaming and whatnot and sweating and everything. But on the other hand, I don't want to get it and give it to someone else.
Correct. That's where I'm at. I don't care getting it. It's just then giving it to somebody else that may not do well.
You have younger children. But again, we both have older parents, and my wife has. But it's and
I'm avoiding. Right. But let's face it, the essential workers are already exposing themselves.
Exactly. Yeah.
So they're already, Michelle's already out there working, right? She's working with the public. You're working, you don't have much contact with the public. But, the healthcare workers, they're working with patients with actually having. Now, we use protection, but that's what we are talking about here, how the average Joe can, in the community, use protection also and do things a little different so that they're safer when they're going out. But it's a question of like who's going to go back to work and whether you can force them to go back to work and whether they get benefits. What kind of benefits are we going to give these people?
We've gotten away from that. We've gotten into jobs there, go work. You have to go to work. And we found out real quick that most people in this country can't afford to miss 2 weeks of work, let alone 2 months of work, because they have bills, and the bills don't stop.
Yeah, I think 80% of the world lives paycheck to paycheck. I don't know if that's maybe a high number, but
it's the general idea. You saw even huge companies that make billions of dollars in profit weren't prepared for a shutdown for 2 months. So how do you expect the guy making, $10, $12 an hour?
So, but that being said, the country and the government runs on money. So the government is writing all these checks to help people out. But that can't go on forever either. They gotta make some revenue too, and the way they make revenue is taxes. And if nobody's working, then nobody's paying taxes, and they're not making any money. So
look at the price of gas and what that does to Pennsylvania, for example. That has a really high tax based on the gas prices.
Based on that. Yeah. Well, look at the state stores that they had to open up because they needed the money. And that's
$6 million a day they were losing.
That's an essential business. Even though you could technically get alcohol at your grocery store now,
Yes.
right?
Yes.
They had to open the state store because they were losing all that revenue. But again, I think there are sensible ways that we can open up. I think we have to open up at some point here as things start to slow down. It'll be interesting to see what goes on in Georgia. It's been a week now, right?
Did they open last week, or is that were they announcing
I thought
it
Georgia
was a
did
slow
already.
open? Yeah. I did see there was something going
Did
around
they
on
just
social
announce
media
they were
that
opening up?
someone wrote and asked when they would be able to tour the governor's mansion because they give public tours, and it's closed to public tours because, which I understand why that was a big deal, because hey, we're open, well, why can't we come into your house? But on the other hand, they're treating it as a slow roll open. It's not like, oh, we're just wide open, everybody go. So
Correct.
yeah.
Yeah.
It was like
And again,
Disney, when you said that they were going to stand 6 feet apart in Disney in the lines, they were going to practice social distancing. They'll be standing in Georgia waiting to get on the Avatar ride.
Yeah, correct. Well, I think they have some other ideas too, like virtual lines. If you have a smartphone, you'll give it a time to come over, and then you wait in your 6 foot apart line.
Right.
Yeah. So again, things are going to be different. You know, if Disney wants to open up, they're going to have to figure it out. Right. And you know, we talked about like Vegas opening up. You know, how are they going to do it? You know, whether they use, you know, you come over to a table, is there hand sanitizer there? Are you going to wear a pair of gloves? Well, let's go into gloves. You know, gloves are only as good as you using them appropriately. So first off, you shouldn't be wearing gloves around the store the whole time, touching everything, and then, you know, getting the soda and drinking it with your gloves on. You're actually better off throwing the gloves away and hand sanitizing frequently, because you got to get into a habit. If you're touching something, you potentially have that virus on your hand. Okay, if you have a glove on, it's on the glove, but whatever you touch, then it's on that. So if you're touching your sunglasses, you go out in your car and you get in your car, it's in your steering wheel. You go to the next store and you're still wearing your gloves. Whatever you touch there, it's on. So I would prefer people to use hand sanitizer frequently, and just remember, you touch something, use your hand sanitizer. Now, it seems overkill, but that's the world we're in right now. That's the world we're in right now. You got to use hand sanitizer, throw your gloves away. You should really only use gloves if you're going to be soiled with something. So that's kind of how we do it. Yeah. That's kind of how we do it. If it's something that's really dirty, we wear our gloves. Okay. Now, we are wearing gloves in the hospital on every patient that, you know, but we throw them away, right? You know what I mean? We go in and see that patient and we throw our gloves away. So if you're using your gloves, you better have a box of gloves, because you're going to be going through them.
Right. That's the other problem is there, right now we're still running limited supplies of hand sanitizer, disinfectants, gloves, stuff like that. And so that's what's led to people reusing gloves and maybe using their masks too long. And that's why the cloth mask may not provide as much protection, but at least you can reuse them, you can clean them, you can do stuff like that.
Right.
And a lot of businesses have changed. We talked about like Walmart is wiping the carts off as they give them to you. So you don't just assume that the carts, like you said, make sure you see them, wipe it down. And they have the wipes when you walk in.
Or
we had to
some places have a self-service. Yeah.
Right. We had to get spray bottles filled with disinfectant for our guys to use on forklifts, for example. You know, everybody's touching the handle, the steering wheel of the forklift. So get it, spray it, wipe it, and it's just like being at the gym. You know, you wipe the machine down every time you use it to protect the last person.
And honestly, that's one of the reasons. Right. Honestly, that's one of the reasons I thought a gym would be a good place to reopen, I mean, as long as you social distance, you pretty much wipe down your equipment. You should. I mean, you should wipe down your equipment before you start and before you end. Anyway, you don't want somebody else's sweat on you.
Exactly.
So you pretty much do that at the gym. So I thought that would be in a place that probably could have stayed open, with certain rules.
Right.
With certain rules.
Yeah.
I mean, you don't want two people. The guy, like every other treadmill is closed or something like that. Rather than people on. And then again, it's hard to wear a mask when you're on a treadmill.
It's going to be learn as you go. It's going to be, open it up and see what happens, and then we're going to have to determine if these places are going to be held liable if they don't protect their customers or their employees. And how liable am I if I'm sick and I go to work? How liable am I for getting everyone else sick? We're a very litigious society. It's sooner or later. There are already lawsuits because this network lied about that, and that person told me this. It's bad that the feds can go in and shut down the televangelist who's trying to sell the silver medicine that's going to cure you, and whatever.
Right.
That's different than someone suing the guy at the next desk because he thinks because he came into work sick and got you sick, and now you're out of a job for a month or whatever. So, with medical bills on top of it.
Right. Well, I mean, I hope they come up with a solution for that, because I don't think you can really blame. I don't think, again, anybody's wanting somebody else to get sick. No. I don't think people are trying to get people to die just because they want to open up their state. And they, again, we talked about this. People aren't. You don't know anybody. You don't know what's going on with other people. That they may be suicidal because they lost their job, or they have a business that's going under. They may be suicidal that they want to get this open with, and they want to take their chance with the virus. Now, true, it can affect other people. We got to understand that, but but in general, people aren't out there. Oh, I want to open up because I'm a redneck and I don't care if I get the virus, or don't care if anybody else gets the virus. Again, it's a gray area. And what I'd like to see is we came together really well after 9/11. I think initially we came together with this, and I think everybody's doing the right thing. But as people are getting a little antsy, we're starting to, divide a little bit. And you want to just listen to whatever the government says, and you want to be a socialist, and that's how they're going to control us. And you want to go out and kill grandma because you want to go give her the virus, and it's like,
and a lot of that antsiness comes from the unpreparedness for this. So you had different states closing at different times. You had different, in Pennsylvania, it moved from county to county to county to the whole state. So there was no roadmap. There was nothing. I shouldn't say there was nothing, but there was very little pre-prepared to say, okay, this is what we're going to do if this happens. And so people now are second guessing because it changed. One of the things we talked about was you look at a post on social media about the CDC says you don't have to wear a mask. They did say that 3 weeks ago or 4 weeks ago, and then it changed. Right. So if you see something like that and you've heard you're supposed to wear a mask, go to the CDC website. It's there. It's real clear. Everything's explained to you if you look for it, if you want to go see what it is. Educating, like most of the problems we have in this country with people who are polarized and arguing with each other, if you just kind of educate yourself from official sources and get an idea of what is now, and understand that it might change in 24 hours or a week or a month, be open to that change too. We talked about that's what science is. I firmly believe that I am right, but I'm going to keep questioning it to make sure.
Right. I'm going to keep hypothesizing that I may be wrong, and prove that I'm right.
Right, exactly.
On a regular basis.
Right. Yeah. It's like with the latest possible vaccine.
And proving myself right to the point where I may actually prove myself wrong.
Right. That's the beauty.
That's part of science. You know. they're trying to prove themselves right. They don't prove themselves right by ignoring the truth. They actually try to prove themselves right, but if they're wrong, they change.
They should change.
Correct.
They should. I mean, there are the ones that do a test that shows that they were wrong, and it's like, oh, that didn't happen. We'll just ignore that one for a little while.
Scientists. I'm talking.
Yeah, I know you're talking
yeah.
scientists, and I'm just talking more research. Like,
Oh yeah. No,
nicotine isn't addictive.
610 lie. Yeah.
Tobacco doesn't cause. Cigarettes don't cause cancer. What about all those tests?
Correct.
Well, those are those tests. We're gonna look at these tests. That kind of thing. Because anytime there's money involved, you run the possibility of someone trying to snooker you or bend it a little bit,
right.
Which you hope doesn't happen in a time of national emergency like this. But the other part is some people don't think it's a national emergency. You go further out west and they think, well, there's nothing up here. Just because New York and California have it doesn't mean that that's going to affect us at all. And,
right.
And that's part of where we all kind of came together. And then if you're telling someone in South Dakota that they can't go to their favorite restaurant for 4 weeks or 6 weeks when they don't understand because they haven't had those kind of numbers that the bigger cities have had, then they stop caring. There's that rally around the flag moment like 9/11 and when all this started, and that dissipates. Usually it dissipates very slowly, and in this case it went a little quicker, primarily because of money, primarily because the economy tanked to go along with it.
Correct. And like I said, everybody's affected. It's not just a region. Like, there's a hurricane here or a tornado there, or a wildfire here that okay, the rest of the surrounding community can come in and help out. Everybody's affected. The whole, in terms of the virus it's hitting, New York, New Jersey, the worst, and there's hot spots. But I'm talking economically because of the way we went after it. Everybody's affected at this point.
Yeah, it almost would have been better had we completely shut everything down for 2 weeks and then slowly tried to reopen it. I think you would have seen that curve come down quicker, and you would have seen more people willing to go along with whatever the plan was. I just don't think we had people who could make that plan and do it quickly and get everybody on board with it. I mean, the president can't say all the states shut down. He can't do that. It had to be up to the governors to do that.
He can't.
And they were all treating it because they didn't want to see their economies go down. They were treating it based on numbers. And those numbers, I heard Cuomo on the radio today when I was eating my lunch, and he was saying, this number is good. The number of new cases is down. That's good. He was going all over. He said, but we still have 300 some people dying a day. We still have 900 new cases a day. He said it's good, it's better, but it's not where I can just say, okay, everybody, schools are open.
Right.
For him to do it, he has to open up the schools, the businesses, and the mass transportation all at the same time. You can't just say, okay, schools are open. You can't just say, okay, the trains are running. Right.
Right. No, I agree. I think we both agree that New York probably closed down too late.
Yeah.
They were actually after Pennsylvania in terms of shutting their schools down and their businesses down. And I think we can honestly look at that now and say they were probably too late. And yeah. You're right. I mean, a lot goes into shutting it down. Again, we talked about the repercussions of being shut down for the schools. The kids aren't getting the support that they need, whether it be, right. Extra care and, guardianship or whatever, the food, that kind of stuff. So, that makes it, a hard decision. Again, it's not black and white. It's not, okay, this is the day that the school needs to be, or the businesses and schools need to be shut down, where it's going to mitigate the best results. Right. It's not like we have a magic a crystal ball to have that answer. So, I mean, we can look at this and Monday quarterback. It's tough in the decision. Same thing with opening up. It's the same thing. It's like, is there an optimal time to open up? The federal government came up with a guideline, and like you said, right now nobody's reached that really. I don't know if we're reached that as a state, but I think in counties we probably have reached that.
Yeah.
Some of these central counties.
Yeah, if you look across the state, maybe.
And I think do you open up by county? It looks like that's what Wolf's going to do. He initially was going to open up by region, and the issues you have is like we talked about is how do you keep a hot spot from becoming spread into there because you're opening that up, because I want to go to a restaurant, I want my hair cut too, I'll just go over there. And I mean, it's not like people don't do that normally. I go to Westmoreland, my wife goes shopping in Westmoreland all the time. So, we go down and go to a restaurant? Yeah. So it's not like, and how do you police it too?
Right.
You can't. I know the states are policing that. I know.
Right. Yeah, that's easier.
Florida's not. Yeah, that's easier. Correct. So the states are policing that. And, it's interesting time that we're having that, where the states are self-quarantining, or not self-quarantining, they're quarantining anybody who comes in out of another state. So
yeah, it's not easy. And the other problem with it not being easy is you have politicians making the decisions, and their concern should be trying to get it right. But it's also always tainted, and I don't care which party they are, I don't care who they are, it's always tainted with, how does this look for me? How is this going to make me look when I'm running for re-election or when I'm out in the public?
How is it going to affect my election? Yeah. It is unfortunate that this is an election year, because it amplifies this so much, because politics gets involved. And it's unfortunate. It's very unfortunate, because that's part of the misinformation and the polarization that we see with the people, because most of that is political polarization. You know what I mean?
And with some politicians, it wouldn't matter if it was an election year or not. Some politicians would base this based on just on the economy.
I'm not, but I think there's a skew in the media too with because it's an election year,
right?
It would be interesting to see how it would be in a non-election year. I mean, you have your people that don't care about the politics of it. You know what I mean? Of course,
there's always.
But unfortunately, it seems to always seep in there, and it becomes polarized. Like, the people that are wanting to open up, they're being categorized as they're leaning on the right.
Right.
I don't know that that's necessarily true. You know what I mean?
There's
I don't know why
in there, but yeah.
Right. I'm sure there's a mix, because it really has nothing to do. I don't think it has a lot to do with political parties. I think just some people want to get moving, get out.
If you cut off the 10% extremes, like we always talk about, 10% on either end, get rid of the extremes, right. And then the extremes are a little closer to normal. But a
little bit better, yeah.
A little bit better. But like today in Michigan, there was an armed militia that tried to get into the state house. Now that just doesn't look good. And that would picture in most people's minds skewing right.
I agree. No, I'm sure they were
like
those. And again, those are the extremes, and unfortunately, that's where the cameras roll to, though.
Right.
You know what I mean? They don't go out there looking at the protesters that are in their cars, social distancing, just saying, hey, we want to open up, people. We want to open up.
Exactly.
And like I said, if this isn't going away, we need to open up and in a safe manner. We need to, change a little bit of how we do things. And I think the American people, even the health experts are saying, you got to open up at some point.
Right. Yeah. Sooner or later. Yeah. It's going to have to be something that you can't hide from it forever. We can't close the country. We can't all stay in our homes. A lot of us are out. You're with people every day.
Right. That's what I'm saying. There's a percentage of essential workers out there anyways.
Yeah.
And if you think about it, are we saying they're expendable?
Yeah.
I don't think we're saying that. So, you know what I mean? What I'm saying is I think there's a population that we need to protect because we can see that this virus really affects them.
Right.
And, we need to protect them.
Right. And it comes back to like our parents, where I told you, my mom said, we missed Easter, our vacation. We're not going on vacation this year. She said, we will have Christmas dinner, even if I have to wear a mask, even if we all have to wear masks in the house, we will have something for Christmas. And who knows, right. Our son's going to graduate this year, and assuming we can have an actual graduation, they said, if we can be there and if it's safe, we will wear masks. We'll take them off for the pictures and put them back on. And your mom's the same way. Your mom has lung issues, and you've told her you're staying in.
She's staying in until July. I told her in July. I mean, I don't care if our state opens up here May 8th. Mm-hmm. She was all excited, and I told her no. She's in until July, and I said if that changes, I'll let her know. But I mean, and there's probably safe ways for her to come out.
Sure.
and do things. But right now, I told her she needs to just stay put. I'm not letting her go get groceries or anything. So,
right.
Yeah.
It's just safe. It comes down to being responsible and knowing
right.
what your risk is and knowing what to do to protect yourself as best you can. There is no 100%. What's our friends say? There are no absolutes. It's you can only do as much as you can, and then you hope for the best on the rest of it.
Yeah. So, I think what they're going to do is they got to take some safe steps into opening up.
Right.
Continue wearing your masks. Hand sanitizing is key. Do it a lot. Get your own personal hand sanitizer. The stores have to have it readily available. The restaurants are going to have to have it readily available. Social distancing, and then they're going to have to watch the numbers and see where we're at. I don't know. Like you said, you probably can't get the genie back in the bottle once they open up. But if they slowly open up, they know they can't go to that next step if the numbers are spiking too quick. Yeah. And then the antibody testing is going to be another key thing because what percentage of the population got this and is asymptomatic, so that we know, if 20% of New York, the state, has it, that's potentially a quarter of the way to herd immunity.
Right. But
in 3 months. So
with the antibody test, though, I thought you had said one of the times we talked, it could almost, not that it could be a false, but you could have had some version of.
There could be. The question is so since they're doing everything so quickly, that we talk about, there are other coronaviruses in the family. So right. Is that antibody test accurate? We probably need to study that a little bit more. Is it that, some of these people had the common cold recently and that's why they have antibodies? It's possible. So, is it, they probably need to study it a little bit more, but I think they're working on that kind kind of thing. So is it that why it was so high? We don't know yet for sure. But that's one of the things that's going to help us know when we can really start opening up. You know what I mean? If we find out that, if we find out that 50% of the people get this are asymptomatic, then we know then a lot more people, because we're not testing, in New York, they are testing pretty much anybody that comes into the system, because they found that, people are coming in with a broken hip and they'd be doing their hip surgery, and then other people would be getting sick, and they figured out a lot of people coming in asymptomatic. So they'd come into the hospital for one reason, and then they find out that they were COVID-19 positive. So they started it was coming in. And so, in our area, we're not at that point because we don't have that many cases. So do we eventually get to that point? I know one of the policies now at our hospital is pre-op testing is COVID-19 is included. We are asymptomatic people in that respect, but we're not testing everybody that comes into the hospital in our area. So there may be a lot of people out there who are positive or were positive that didn't have enough symptoms to warrant going to anywhere to even be tested. We don't know that answer yet.
Whenever they talk about mass testing being the key to opening up, that's what they mean. If 50% of the people have had it already, well, then we're ahead of where we think we could be getting that herd immunity.
Where we think we are,
So more testing, being careful, mitigation. Hand washing, masks where appropriate. 2 quick stories about masks. I had to go into Walmart earlier this week, and there was an older couple with a younger girl. She was like 6 or 7, and I heard the girl whining as I was walking in, and I laughed because it wasn't my kid. And the older gentleman said, if she doesn't want to wear the mask over her nose, don't make her. I don't either, because it bothers me. And he walked in, and 2 of them walked in without their nose covered. No help. Now, today I walked into a convenience store, and they have 2 big signs: no mask, no service. So I had parked the car, reached down, grabbed my mask. I'm putting my mask on. I watched a guy walk in, use his shirt to open the door so he didn't get his hands, didn't touch anything. No mask on. No mask whatsoever. He read both signs and walked in without a mask. Made it 3/4 of the way through before someone finally said, "Hey, you got any?" He said something to them, and they said, "Too bad." And they sent him out, and when I was leaving, he was coming back in with a bandana around his face, which is at least something. But there are still people out there that are just not paying attention, and that he knew enough. He didn't want to touch the handle of the door, which you could hand sanitize, before or after that. But he didn't wear a mask while he was walking. People need to pay attention and do a little bit right now so that we can start to do less as we move along.
Later. Correct.
See, we agree on these things. This is so easy. We just don't have enough money to start our own Facebook.
We don't. Or run for president.
Who would want to? I will never run for office like you will never be a surgeon. We have our reasons. It's not going to happen.
I'm never going to run for office either. So.
And I will never be a surgeon either. So, we don't have to.
There you go.
Those things happen.
We agree on that too.
Yeah, exactly. And that is one thing that you and I talk about all the time.
One caveat.
Go ahead.
If there is a true apocalypse, like, zombie apocalypse, I wouldn't mind being a surgeon.
Why?
I wouldn't mind, I could step up then,
Oh, I see what you're saying, yeah.
You know what I mean?
Yeah, I do, yeah. But we would never survive that. We can't...
Correct.
We can't get people to merge properly leaving a football game in Pittsburgh. We would never survive a zombie apocalypse with people with the monsters roaming the street. It would never... we would turn on each other in an instant.
Again, this mortality is relatively low.
Right.
Compared to some other plagues that have hit, us historically.
Right.
So, is this a way for us to wake up and learn combat something that may be bigger down the road. I think that's a little bit of a lesson that we need to have, and we've got to do our part.
Yeah, we have to learn how to learn from these things. We can't just say, okay, we made it through this. Now let's reopen the economy and let's get back to normal. It has to be, okay, this happened. We weren't prepared. It's going to happen again. Or if it's not going to happen again, we still have to be prepared for the situation, because it might not be this. It might be something worse, or it might be a disease that spreads just as quick and has a higher mortality rate, or spreads and it's like the zombie apocalypse, and you get it and you don't find out until you die, and then people are crawling out of the ground and you got to shoot them. Oh wait, let's go back to that too. I compared this to the Walking Dead, because everybody can get it. In the Walking Dead, everybody had it, and it didn't matter, you just had it. And if one person has it, like in the prison season, one person died who they didn't expect to die, and he spread to the zombie because he was biting people in the night and they didn't know he was there. But we have to remind people, do not shoot people in the head who have the coronavirus.
Correct.
We don't have to burn the bodies. We're good.
Right.
Okay.
There's a pretty high survival rate.
Very high survival, which is great. And losing anybody is awful, especially if it's someone that was trying to protect themselves and got sick. And we've lost famous people. We've lost in Italy, they couldn't even have funerals because there were so many dying at one time. It's an awful, and it takes a toll on the entire human race, just stress-wise. Just everybody's stressed about it, and everybody wants it over with. But like you said, we have to learn from it too. We can't, once it's over, we can't just say, oh well. We have to learn what happened and continue to learn about it, so that if it does happen again, we're better prepared. And that's not political.
It's not political. I agree. One of the things we can do individually is prepare our bodies for this. Again, there are genetic issues involved with a lot of these disease processes we talked about, that are high risk. But in general, if you do, regular exercise, eat appropriately, you can reduce those medical conditions also, which, so as you see with this, I'm just kind of putting a plug in there for some preventative medicine that it's not going to help you now, but maybe for the future. You know what I mean? The next virus is probably going to have similar, issues with people. The vulnerable people are going to probably almost always be the vulnerable.
Right.
And if we can do what we can do, quitting smoking, losing weight, eating right, regular exercise, is all a good. It's only going to help you. It's not going to hurt you.
Yeah. Smoking is just not good for you. Vaping is not good for you. I don't understand why people don't understand that. I know it's addictive, and I know there's that whole issue with it, but it's just not good for you. I don't know why. I don't know how many other ways to tell people that it potentially could kill you. Now, I've known people that smoke their whole lives and never had it, but they're more the exception than the rule. And once you know that one exception, then it's easy to say, well, I can be an exception too. But it's not. The people that I would see out smoking, getting one last drag in before they put their mask on to walk into the store, and I just want to shake them and go, you're not getting this, are you? You're not understanding. But they had to wear the mask to go in the store, so they wore the mask, which was good, but they don't understand what they're doing to their bodies, that they're not prepared to handle, like you said, if it happens again or whatever else comes down the pipe. Well, what did we say the other day? People are stupid. A lot of people are stupid. They just are. I mean, we do stupid things. You and I do stupid things.
I'd prefer to use the word ignorant.
All right. If you say that, I think people do stupid things sometimes.
I think they can learn. Yeah. They just choose. They may choose not to, or they may not put the effort to do it.
I think some people choose not to learn. I think they know. They know. They don't need to be told.
Well, I don't know that I think, again, change is, nobody likes change, so none of us like this new world that we're living in. And I think education is change. Educating yourself is change. So, and a lot of people like the status quo. So why do I need to do that kind of thing? That's the attitude. But
and I
don't
get
think
that.
that's stupid. But,
I choose to use simple words. I'm a simple person.
Okay.
Simple words.
There's a little different meaning to the two. Stupid.
No, because I'll admit that I do stupid things, or I have done stupid things.
Well, but you're not.
You ended up being in a bad situation, or you ended up, making yourself sick because you did a stupid thing. That happens. So I used to, and I wasn't ignorant. I knew what I was doing. I just did a stupid thing.
Well, you do stupid things. That doesn't mean you're stupid.
No, but I think that there's the George Carlin line of think about how stupid the average person is and realize that half of them is stupider than that. That's how. So stupid is the word that I use, but I understand.
Okay.
And again, I didn't mean to trigger anybody by using the word stupid. So.
And again, I think for the most part, most people have really handled this rather well.
I agree with you, and the fact that there aren't riots and people storming the streets. Yeah, think about how much crime has gone down. This was the first March that there wasn't a school shooting since 2001.
Wow.
Yeah, because there was no school. That boggles my mind.
Yeah.
Was it Florida or someplace I can't remember now, where they went a whole month without a homicide. It might have been a particular county or something. It's like, because people weren't out. Now that doesn't mean that, someone didn't kill somebody in their house and nobody knows about it yet. Right. But for the most part, even crime is down, because people listened and they stayed home and they stayed apart. And you can see, the environment dealing with that. And
the environment is sure like clearing. This for sure.
And animal, it's so weird to look. It's like post 9/11 when you look up and see no planes, and you go outside and you can hear the birds and you can hear stuff because there's less traffic and there's less of everything. And it's, unfortunately where we are, the weather's been crappy, so days to be outside haven't been that many anyway. But it's just amazing how quickly, and this is something that we've known forever, is without us, nature would take back over immediately, and everything would be overgrown, and all the animals would come back because humans terraform, and that's what we do. But it's just amazing how quickly things started to general things like pollution, ozone and whatnot, that all global or greenhouse gases, that takes a long time to dissipate. But in general, pollution, water pollution, air pollution, how quickly it cleared up just by us saying, okay, time out.
Down. Yeah. So that's an interesting thing. Do you create a is that part of a solution in the future? Maybe not go full Green New Deal, but do we do timeouts?
Yeah.
Do we do regional timeouts? Do we do something like that?
Take the month of July off. Take the month, or the month of, probably in the spring, probably be better. When you're not running air conditioning and everything.
One of the things Trudy said to me, she said, "Well, what would be nice is if places were closed again on Sunday when we start back up, like, just be closed on Sunday. We can do without you 1 day a week.
Yeah.
We did it for 6 weeks now. So close on Sunday. The store should be closed on Sunday. Obviously, pharmacies maybe need to be open, but everything else. If we got used to it being,
people would adapt if things, even if the pharmacies were closed.
If you knew you couldn't get your milk, if you knew you couldn't get your milk and eggs on Sunday, you got them before then.
Right. Yeah. And if there was an emergency, you're generally SOL. There might be a gas station that was open, something like that, but there wasn't 24/7, and there wasn't. And now we sound old. Welcome to two old guys talk about when they grew up. But it's true. I mean, a lot of this, short of having the internet and being able to be in touch and watch, movies and all that stuff.
It's back to where we were at when,
right. Before that. It's just, you don't go out as much, and you don't go on vacation, and, you sit around the house, and you get your grocery shopping done all at once, and then you go home, and you don't go to the store 9 times a week just to pick up every little thing because it's convenient. You get what you need, right, and you get home. And we could use more of that. Really, when you look at the positives, people will try to post positives about this. That's one of the things is a lot of people are happy to be home with their kids. A lot of people are happy for the time. The ones that are being financially, drained and I'm sure people, that are homeschooling and everything. We don't have that issue. We have a senior. He's taking care of himself. We don't have a lot of homeschooling issues. But, there's been a little more slowing down of society, which I think we needed. I think we needed to kind of.
I agree with that. I mean, I know my life is hectic. I know your life is hectic with everything that's going on, and I know people that have nonstop issue stuff that they're doing, and I'm pretty much like that too. That's how I have to have something going on the weekends. We'd like to do things. The evenings are a little different. I like to not do so much on the evenings, but with the kids, there's always something going on. It was a nice thing to just slow down and slow down. And I know one person, more than one person that they're just constantly on the go, and it's like it probably was a relief for them to just, at least for a little while, to just say, okay, I don't have to run so much.
Yeah. So there are some positives from it. Well, thank you. I think this actually worked this time.
All right.
So Michelle gave a little cheer dance over there whenever I said that. So I'm gonna say thank you again, and I'm gonna stop the recording.
Well,
go ahead.
Okay. Go ahead. No, go ahead. I'm done.
No, you can say.
No, I was gonna say if it didn't work, then we're gonna just get Michelle to try the 4th time because she should have everything memorized. What we said.
So she can just record her saying both of our parts. She'll do that.
Right.
No,
she can like
gonna happen.
put a gray wig on and then a brown wig on and then just flip back and forth.
Why would she have a gray wig on?
I don't know.
You should have seen the pile of gray hair when I got my hair cut. My son-in-law said, "Well, you got a lot of gray hair." I said, "What? Where? What? Yeah. Gray hair?" Thank you, Hold on, I'm going to stop this.